Good afternoon and welcome to our webinar today. My name is Rebecca Winkelmann and it is my pleasure to announce today's speaker, Professor Christian Hagist, Chair of Economic and Social Policy at WHU Otto Beisheim School of Management. A warm welcome to you. Before Professor Hagist will start with his presentation, let me quickly revisit some of the housekeeping announcements. So you may have noticed that your microphones and that your video cameras are muted by default and that they cannot be unmuted. This is because we are expecting quite a large audience and to ensure the quality of this webcast. Nevertheless, we would like to encourage you to interact as Professor Hagist will first give a presentation, but then afterwards has dedicated some time for your questions. So we will host a Q&A session for all your questions to Professor Hagist after his presentation. To ensure that we get all your questions, please make use of the Q&A button, which you can find on your lower menu bar in Zoom. It's labeled Q&A, or if you're dialing in from Germany, maybe F&A. Please put all your questions you have to Professor Hagist into that box. In case you have any other technical questions or comments, or in case you would like to initiate a discussion between participants, please make use of the chat. Also, the chat can be found again on the lower menu bar in Zoom. One final remark is that we will record this webinar and that the recording of the webinar will be made available to all the participants after the webinar is finished. In this email you will then receive, we also offer you a couple of follow-up options. So in case you would like to learn more about WHU and its program offerings, or in case you would like to simply stay in touch with us, make use of those follow-up options. Or of course, you're always invited to also send us or contact us via email through webinar@whu.edu. And again, welcome from my side and a warm welcome to Professor Hagist, and the floor is yours.
Thank you, Rebecca. Good afternoon, everybody. Thank you for taking the time to listen to my thoughts on Corona and its implications for the coming generational storm. The coming generational storm is a research topic of mine for now, I guess, all my academic career, 15 years or so. And obviously, COVID-19 is something rather quite new. So I try to let you into my thoughts about how this will change the setup of the generational storm coming on. And I will also define what I mean with a coming generational storm and the implications for you. First, let me begin my talk with why do I think it's okay to stand here to talk to you as an economist. Obviously, I'm not a medical person per se. I don't have a medical license or education. And if you follow the media, some people are saying that actually, because life cannot be valued in monetary terms, and economists, for example, are using monetary terms very often in their analysis. So actually, why should academics like me say anything about COVID-19? Because if life is not measurable, then what's the sense of an economic analysis per se? And that's probably a quite a normal judgment in humanitarian terms if you talk to doctors who really have to face severe decisions about giving a patient a bed or not. That's philosophical questions which come to the core of our humanity. But in general terms, especially in policy terms, that statement is not true. Why? Because we trade off, we kind of judge our life, we value our life personally, but also in a societal way all the time. Yeah? Personal, I did it, for example, just now. So I took a car, drove 100 kilometers here to Fallendar to give this webinar. Why? Because I think that I can provide perhaps some interesting insights to you, and also hopefully make my employer a little bit more happy. So kind of value my paycheck in that regard. So obviously I took a risk by driving that car 100 kilometers above the Autobahn, which there's a certain risk of getting severe injuries or even dying. And I valued that risk against that benefit of giving this webinar here and talking to you this afternoon. And you do this by riding a bike, obviously, by flying, by smoking. Basically, every cigarette is kind of that value judgment. You know that smoking is not good for you, therefore, but you trade a little bit of statistical life, so to speak, for that good taste of that cigarette. Or if you follow my sin, for example, then eating Nutella is basically also the same. I know that I shouldn't eat Nutella. My wife is saying that I shouldn't eat as much Nutella. However, I'm still trading off here because it tastes very good. So therefore, if yes, in some situation, perhaps in immediate situation, valuing life is quite risky, is a philosophical, quite dark path, so to speak. However, in statistical terms, we do it all the time, and therefore we can also include such thinking in an economic analysis, in an economic model, for example. And again, also politicians, which are at the core now of the COVID crisis, to decide how are we going to have more freedom in society, have the lockdown reversed, in what kind of steps do we do that, which kind of group can now go to university or to school, or to should we open up restaurants or public swimming pools. All these decisions basically are decisions about statistical life and not about concrete persons. So it's not like the politicians are actually deciding who's going to die, but they're deciding on what's the likelihood of perhaps people dying in the future if we open up the economy again, for example. And again, this is a hard decision in COVID-19 times, for sure. I don't want to trade with anybody in charge right now, but it's a decision politicians are making on a regular basis, also in quite normal times, right? So if they have a certain amount of money and they're thinking about investing that, for example, in a new bridge, compared to investing that money in dementia research, they're saving different kinds of people. So they're trading off different kinds of lives and statistical lives, so to speak. Or even with very broad policy questions like, should we invest in education or in higher pensions, right? We know that with higher pensions, perhaps life expectancy, especially of poorer pensioners, is raised. So you therefore you are helping that one group. However, you also know that when you invest in education, that especially people with a low education background gain life expectancy because, for example, they eat less Nutella or eat healthier over their long lifetime. So again, there's this kind of trade-off, and politicians are used to that, right? They're probably not thinking about that the trading here, statistical life, but still that's basically behind with all these decisions they're making. And COVID-19 is not different from that. It's different from the regard that it's something quite new, and we don't have a lot of experience with these kind of questions, and it's quite the uncertainty is making these decisions quite harder. But still, they are basically normal decisions by politicians, and they're used to in their everyday work. So, given that, I think that we can answer the question, should economists talk about COVID-19 anyhow, with a certain yes. I think that our science can help analyzing the COVID-19 situation and bringing society forward as well. And there are a lot of questions economists can address and are addressing, obviously, also colleagues here at WHU. So, for example, you can analyze what are the best macroeconomic responses to the COVID-19 crisis, because it's quite interesting. It's now an aggregate demand and an aggregate supply shock, basically. So both sides of the equation are shocked. The supply, obviously, because people can't go to work, because supply chains are broken, and so on and so on. And obviously demand side, because people hold their money together and they're not going out to consume or to do to eat it at restaurants or anything. So you can analyze that, but you can also analyze, and that's more my topic as a public economist, who's basically, where are these trade-offs going on? So who has to take the burden from this COVID-19 crisis, especially from the economic one? But I will also talk about the medical side a little bit during my presentation. So, for example, what we can already see is that there is obviously a low-skilled versus high-skilled labor trade-off, in the sense that high-skilled labor is much more likely to have the possibility for home office. So it's not as much hit by the COVID-19 crisis as the low-skilled sector, which has to go to work or which is laid off to a certain degree. So obviously we have here a distribution problem. We also have a distribution problem by gender. So male are, at least if you look at the current statistics, are more likely to die. So the benefit of social distancing is perhaps helping more males than females. That's a big if, because the data is quite sketchy still. But it could be that males are more helped by social distancing. But however, if you look at statistics, for example, who is doing the more housework because of staying home, because of social distancing, or who is doing the homeschooling of the children, it's mostly females, right? So perhaps female careers are stopped or at least paused more than male careers during COVID-19. And therefore, again, we have a kind of trade-off between these two groups, between males and females. Again, this can be a big if, because it has to be seen if really males are more benefiting from social distancing, or if this is just sketchy statistics at the moment. Probably the homeschooling part and who's taking the burden at home is probably quite sure, at least I have to admit, in my household as well. And there's another question, and this is now my research question. This is what I want to talk about with you during this next 25 minutes. And this is the old versus young, because the COVID-19 crisis is basically, in a nutshell, the generational storm coming over the next 20 years. And it's worsening the situation for that generational storm, so we can master this generational storm quite severe. So our starting position for this generational storm is worsened every day by COVID-19. And I will show you in a minute how this is working out. So again, here, just to show you that we can do that, a value of life study. You can see the values are quite old. This is not done on a regular basis, but just to give you an impression that really also in economist terms, every life has a value, right? And every life is valuable in that sense. You can see that obviously these values are decreasing by age. Why? Because obviously you have less years to live on, so therefore your complete life is worth less, but not the yearly life, but rather the total amount of summed up utility, so to speak, over your remaining life. And you can see that in normal times, at least 20 years ago, we see that a life year gained was for most age groups had a higher value than the marginal costs per life year gained, right? And the question is this still kind of holding in the COVID-19 crisis? And I can't give you a definitive answer for that, but I can give you some hints to make up your own, basically, decision about that, or forming an opinion about that. But you can see that economists have done this on an irregular basis over the years here, and this is the most prominent example. These two studies are basically the state of the art, given this research question. I stole this term generational storm from a teacher of mine, just to make that clear. The coming generational storm is a term coined by Larry Kotlikoff, who is a professor at Boston University, who has done his whole research life, and he's now turning 66, if I'm not mistaken, his whole research life about generational issues, about generational equity, about generational distribution. And he's quite worried about the generational storm hitting the US especially. So about that entitlements like Medicare, like Social Security, like public pensions cannot be financed anymore in the future because demographics make it impossible. He's so committed to that topic that he ran the last 2 terms as a write-in presidential candidate to kind of gain traction for that topic, because he really thinks that this is hitting the United States especially very hard. I will show you with the example of Germany that also Europe, Germany especially, but Europe in general, you can generalize that for OECD countries quite well, that we will also have a generational storm which can already be seen, and where COVID makes it even harder to kind of cover that storm or managing that storm from a political perspective. So what's the storm? The storm is quite old, right? I'm sorry about the German chart, but I will give you the essence of it. So we have a long-term decline of fertility in all OECD countries, in Germany especially, right? Germany, Switzerland, Austria, Italy, Spain had very, very low fertility rates, right? And you can see here, this is a very long-term trend since basically over the last century. So Germany for the last 40 years had fertility rates of 1.4, 1.5. You need 2.1 to have a sustainable population. So you can see there's quite a gap between this the actual value and this 2.1 value, where you have a stable population, meaning that we have less and less children, and obviously this drives up the average age of a society, right? Less and less children means also we have less and less future workers, therefore making it harder to finance our benefit systems, for example. You can see that this trend is not easily reversed. The blue line is basically the statistical hard line, and you can see the only exception from this decline was during the baby boom after the Second World War. So this was the exception, and the follow-up was rather the rule that fertility is really declining. In the last years, we have seen a kind of trend upwards, which is nice. So people have, again, more and more children. Perhaps COVID-19, with staying home, will change that as well. But if you already have kids, then this is quite stressful. So we will see. The proof is still in the pudding there, I guess, as well. But you can see that, at least for Germany, we have a slight uptake. Again, other societies have lower values. Japan, Korea, for example, Italy. Other societies have higher values. France, the US, Sweden, Norway. But all had this kind of decline from the baby boom years. So the baby boom in the US was much larger than in Germany, and then the fertility rate declined, not as low as in Germany, but still lower. And the same holds for countries like Luxembourg or Norway or Sweden. So we have now a little trend upwards, but still less children than we would need for a sustainable population. The other trend in demographics is that we are getting older, which is quite nice, right? Life expectancy is going up. And you can see here the latest numbers from 2018. I'm sorry about the small font size, but still you probably can see that here the upper value is Japan, where a Japanese woman at birth is getting 87.5 years old. So Japan is the world champion of life expectancy, but you can see other countries are quite close. as well. Germany, for example, here is somewhere in the middle. So German girls currently would get 83.7 years old, and boys, the male sex here is the weaker sex when it comes to life expectancy, is around 4 years less, 4 years plus less life expectancy. This may also be perhaps an explanation for the COVID part, that obviously the male lifestyle is not very healthy, which you can actually see very nicely here in these life expectancy numbers, and this perhaps translates also to the slightly higher mortality with COVID-19. However, these numbers here are not wrong, but they are wrong if you want to look in the future, because these are the mortality rates basically from the past or from the current mortality rates. But we now know that because of medical technical progress, we will die in the future less, right? Because we will have diseases cured, which we can't cure now. COVID-19 probably is one of them, hopefully, that we will have a vaccine, so people will not die as much as currently. And therefore, so this number here is a static number. If you look at the dynamic numbers, these are here, then you can see that already in 2010, German girls were getting quite older, and German boys as well, than the official statistics actually covered, right? So this is a phenomena, again, which we can see across the world. It's not a German phenomena. This is the same for the US, it's the same for Switzerland, it's the same for Italy, or most OECD places. If you look at if COVID-19 really will change that pattern, this is an interesting question. Currently, we don't see it for Germany. We see a little bit more mortality in Italy than we would have seen last year, for example, at the same time. If you look at the Spanish flu, which is perhaps kind of a reference point for that, then there was a dip in life expectancy, which is hard to kind of statistically calculate because it was also the First World War around. But still there is a dip, but afterwards the trend again is up, right? And as you have seen, for example, Germany has a lot of room to cover to kind of advance to Japanese levels. So therefore, I don't expect that this trend will be changed by COVID-19. Perhaps we'll pause for some years because of the crisis, but it will not change dramatically over the next 20, 30 years, right? So this has changed the German population quite extreme, right? The decline of fertility and the increase in life expectancy, this has led that the German pyramid, right, which you can see at the beginning of the last century. This was still a pyramid in the mathematical sense, right? You have many children and then less and less elderly folk. Has changed quite a bit, and now we are having a kind of demographic Christmas tree, you could call it, right? And again, this is a structure which obviously is specific to Germany, but which can be as a pattern seen also in other countries, right? You have these baby boomer generations, which you can see here very nicely around the age of 50 to 60, which will go into pension, obviously, in the next 10 to 15 years, starting basically in the next years to come. You have elderly folk already in pension up there. Left is men and right is women, and you have less and less children, obviously, right? So you have some small booms, right, which then also leads to a little bit more births, but in general terms speaking, you can really say, okay, there is less and less children. I want to highlight the number here, which is currently 34, which is the old age quota, meaning that 34 potential pensioners, 65 years and plus, are covered by 100 potential workers between 20 and 65, right? So you can say that 3 potential workers are basically carrying 1 potential pensioner. Obviously, again, COVID-19 won't change that dramatically. At least in my opinion, I don't think so that this ratio will dramatically change over the next years. So if we have this Christmas tree, we can do a journey into the future, right? And for example, we can go to the year 2032, which is a crisis year, not a COVID crisis year, I guess, but it's a pension crisis year, right? Because now basically the baby boomer generations are entering pension age, and therefore we have less workers covering much more pensioners. This is a generational storm Larry Kotlikoff is referring to. And again, it's the same for the US. Even the year 2030 is a breaking year for most of these OECD countries. Why? Because the baby boom happened at the same time, right? So this is, again, generalizable. If you would look at other statistics, again, a kind of similar picture is there for Norway, for Sweden, for Italy, or Switzerland. So you can see the old age quota here is now 46. So the ratio is now 2-to-1 instead of 3-to-1, right? And remember, this is kind of like carrying somebody, right? And now before 3 people were carrying somebody, now 2 people are carrying somebody. So there's an enormous extra burden on the shoulders of these potential workers. And if we go furthermore in the future, right, then the Christmas tree becomes kind of a nuclear mushroom. I'm sorry. Here in 2050, for example, this is then. I'm sorry. This is in 2050. Here, you can see that this is kind of a nuclear mushroom cloud. Why? Because for long-term care, right, then the baby boomers are now entering the long-term care cohorts of 80 years plus. And then in 2070, we have finished that kind of demographic transition. Why? Because we are still a very old country, but now the baby boomers are basically gone. The whole thing looks like a Dönerspieß, right? Like a Döner kebab now. And so we have a kind of new steady state, a new equilibrium, demographically speaking. Yeah. So now you can say, okay, yeah, this is kind of like, this is not academic work. This is like going to an exotic seminar talking about the future and so on. And to a certain extent, you are right. What I can't predict is, for example, really how many children people are getting. Right, I'm calculating this with a fertility rate of 1.5. So if COVID, for example, really changes the fertility pattern and we're now getting more children, then obviously this picture will have to change. And we have more young people. I can't promise that nothing changes about life expectancy, but I'm trying to have a very conservative scenario. And the third thing, what I can't predict is migration. And in my mind, this will be the biggest change in years to come from COVID. I think that Germany will get, for example, much more migration again, because probably we are coming out better than other countries out of the crisis, and our labor market will then take up extra workers from outside. So this is a special German issue, probably, which is not holding for every other country. Yeah? But the 2 other trends are holding. But still, there's some variance, there's some uncertainty in this picture, but I think that the general picture here is not changed dramatically, even if the fertility rate kicks up. Why? Because children need 20 years to become workers in that model, and obviously we haven't seen fertility increases dramatically speaking over these years, and this will also not be by COVID-19. So I guess this generational storm is coming still, and this generational storm is particularly troublesome. Why? Because we have a public transfer and benefit and tax system, which relies on an intergenerational contract, so to speak. So Germany as a state, as a society, but also the US, also France, also Italy. I've done this in my PhD thesis for many countries. If you look at that, basically all have this kind of the same picture as you're seeing here. This kind of intergenerational contract where the middle generation is basically paying into the systems and the elderly generation and the young, very young generation is taking out of the system, right? And this is kind of a philosophical contract because it's obviously not in writing, but this is how our society, our systems are functioning, right? Our pension system is functioning. There's nothing safe. There's no capital really there. It's just like a contract where they're saying, okay, when I'm young, I'm taking care of the elderly, and if I'm old, then the young will take care of me, basically. That's the intergenerational contract. And now, obviously, COVID-19 will change that, right? How will it change? It will change that, for example, health expenditure is becoming perhaps more generous, right? And in this regard, then we'll change these lines. How? This is quite unsure currently. In what regard? But obviously, tax payments will go down, contributions payments will go down. So this will be dramatically changed at least for 2 to 3 years, right? Hopefully afterwards we are in a recovery, and then therefore this picture will hold again. However, this is challenging, this picture. Why? Because if you take the demographic movie I just showed you and lay it over that picture, basically, you see that our public debt is much more higher than it actually currently is, right? Why? Because we're making promises we can't finance, at least with the current finance structure anymore. Yeah, this is what we call the fiscal gap. So in Germany, we are very proud of ourselves because our official public debt is only 60% of our GDP, at least before COVID-19. Obviously, this number will go up dramatically now with COVID-19. My guess is at least 20 percentage points, but perhaps even higher, right? So we will have 80, perhaps 90% of public debt. This would be a number to look at in the coming month. But you see below that, there is, like an iceberg, a much larger number. And this is coming from this generational storm. So we have make so many promises in pensions, in medical benefits, in long-term care benefits, which we can't finance with our current demographic structure because we have so many less young people, that this is a calculation which is not holding, right? And again, the same is true for even Luxembourg, for the US, for Italy, for Norway with its rich oil wealth. Even there, this is somehow true, not on the same level, obviously, but in quantitative terms. And you can see I brought you the numbers here. To finance that, we would have to increase taxes, every tax available, by 10%. Obviously, not in COVID times. We should do that. Yeah, but you can see there's a quite large number. So this is the generational storm, and why I think is now COVID-19 basically this generational storm in a nutshell. Therefore, you have to look at that chart here. So this is a very new paper by Greenstone and Nigam, who calculated for the US who's benefiting from social distancing and to what amount, right? And this is quite interesting. You can see here that this is a very, very large number. So the total benefit of social distancing, of staying at home, of the lockdown, if whatever word you want to use here, is up to 80 trillion US dollars, right? So you can say that probably for the German number is somewhere around between 1 and 2 trillion, right? In comparison, yeah, perhaps because the population is smaller, obviously, but it's a huge number. It's a huge number. So this kind of policy to really leave people at home, to isolate people, to have social distancing is bringing up huge benefits. Why? Because people are not dying, and I showed you that there is a value of life, obviously, so we can calculate that, and they use these papers I showed you before to calculate this paper. What you can also see here is that it's mostly benefiting the old. Again, which is kind of going hand to hand with the medical evidence that especially elderly people have a higher likelihood to die from COVID-19. Not saying that young people can't die or that it can't be affected with extra burden of disease or anything, but still, statistically speaking, it's the old who are benefiting. Yeah. So this is why I think COVID-19 is basically this generational storm in a nutshell for the next 3 years, because it will be interesting to see how we balance these out, right? The benefits for the old, however, who's taking the burden? I mean, the burden is mostly on the young, right? Pensions are quite secure in most countries. So the old, they're staying at home, but they're getting their paycheck, aka pensions. However, the young, they are losing their paychecks because they're losing jobs, obviously. Or the very young, like my children, for example, are losing education, right? Which has severe effects, which we know statistically has severe effects for their future income, for example. So this is not only a philosophical question, but a hard economic one. And obviously, somebody has to pay back that extra debt we are now taking to kind of finance our benefit systems in these hard times, right? So it will be interesting to see how we balance these things out over the coming months or coming years until we have a vaccine and then until we kind of reach again a steady state in better terms, a better steady state. And this is basically the generational storm in a nutshell, because exactly the same questions we have to address in the near future in 10 years to come. Why? Because, for example, engines will have to only increase moderately, otherwise they're not sustainable. Otherwise, we can't finance them. Our health systems, which are now going under a severe stress test, this severe stress test is coming in 10 years' time anyway. Why? Because chronic diseases will massively increase. Now, I'm currently writing a paper together with Stefan Fetzer from the Hochschule Aalen and my doctoral student, Valeska Milan, where we show that the 10 most common chronic diseases like back pain, like diabetes, like cancer, these will severely increase up until 2040. Yeah. So basically bringing the health system to the capacity constraint, which now COVID-19 does, right? So we will have COVID-19 basically every year for the health system because chronic diseases will so massively increase. Yeah. So we have to make sure in the next 10 years that our health systems are as efficient as possible. Yeah. And obviously we have to make sure that our tax and benefit systems are as efficient as possible, not only because COVID-19, not only because of the recovery, but also because of the coming generational storm. And obviously now it makes much more harder. We haven't used the last 10 years of a quite healthy economy. Now we have to do this in a quite quite sick economy. So this is really, really through COVID-19, a new starting point and at a lower level and at a harder level. Yeah? However, if you don't do that, then people will just vote by their feet and find a country, find a spot where people are managing to do that. Yeah? So this is also kind of a competition between economies, who is doing best in the end. And obviously, if people are leaving the country, this will be the high skilled or the higher skilled. And then this has, again, severe effects on these systems. Yeah? So better make sure that you're doing your homework there as politicians and as a society. How? I mean, this is again a policy debate, which is also kind of normative, obviously. Of my point of view, right? If you read currently Twitter accounts or also policy pieces in the media, then they're often very critical about market-orientated health systems, for example. So their take on the COVID-19 crisis is that public health systems have showed that they are most efficient, right? And they are obviously looking at the US, for example, for that. I would say the proof is still in the pudding, right? Because if you look at the statistical measurements here, and you see that more market-orientated systems like the US, like Germany, have, for example, more critical paths. Yeah? So perhaps the mismanagement of the COVID-19 crisis in the US is not one of the health system per se, but rather one of the politicians in charge in that regard. And you can also see from the statistics why Germany perhaps has a lower mortality rate than, for example, Italy, because we have also more inputs here. So it will be an interesting debate how we make sure our healthcare systems are up for the job, not only for the next pandemic, but rather for this pandemic like diabetes, which is coming anyway, and which is coming to all OECD countries because of the demographic development I have showed you. And the problem is how to do this in a democracy, right? So from a technical point of view, it's clear what to do, but how you should do this in a democracy, and this is quite hard. Why? Because the median voters' age is going up, meaning that 50% of voters are now older than 55, right? So as a politician, it's smart policy to actually increase pensions, to actually have more social distancing, to actually attribute more to the elderly, because A, they are more, and B, they also go more to the voting booth. And again, this is not a German phenomenon. This is also the same in the US, that young people don't go to the voting booth as much as, for example, 60 to 69-year-olds, as you can see here from this little chart. And again, we have to find a solution for that problem. We have to find the right balance between these huge benefits, for example, for the elderly, but also between the costs. Why? Because otherwise there will be voting by feet. Thank you very much for your attention. Hopefully you took something from this webinar, and I'm looking forward to your questions. And stay healthy in these times and take care of yourselves. And hopefully we see you in the WHU context anywhere else, also in person at some point of time. Thank you.
Thank you very much, Christian, for sharing your insights. In the meantime, of course, our participants already asked quite a few questions, and of course you are still invited to continue asking questions. I would like to start with one based on the value of life. Could you say again how this has been calculated?
Yeah, good question, actually. So they took a lot of data here of willingness to pay, basically, for certain things. So, for example, in the US, how much less a house costs in a area where there's flooding, right? Where there is the danger of actually dying. Yeah, and they compared prices between houses which are kind of secure, which are houses not secure, or between jobs which are like how much is the wage of a fireman, and with the same educational level, something else which is somehow felt as more secure, right? These are normally the things that you do willingness to pay studies, and then look at these values. And Murphy and Topal and Hall and Jones, they took more studies together and basically mixed up these studies to come up with these measurements.
And also a quite sensitive type question, and the question asker specifically said that this is not the personal opinion. Would, in economic terms, would it be better to let elder people die, less old people, hence smaller generational storm? And based on that, the next question: has Italy's generational storm been decreased by COVID?
I think no and no is the answer. So it's not like that. I would suggest that. I rather would suggest that it's amazing how large these benefits from social distancing are, right? However, you have to compare them with the costs, and the problem is now, if you take these values seriously, from the Greenstone and Nigham paper, then there we have the benefits. We don't know the cost sides yet, right? Because it's hard to calculate the educational loss, for example, that people are not going to school, and so on and so on. So what I'm only saying is that, yes, there's huge benefits, and I think media and politicians have looked at that, and this is important, but there's also a cost side, and it's the same with the generational storm. We have to kind of balance it. I don't think actually that Italy is now in in another form in the generational storm. We have seen a slight uptake in the mortality rates in Italy. Still, I don't think that the pattern of life expectancy will change dramatically over the next 30 years, right? It could be changing about the next 2 years, 2 to 3 years, sorry. But just to give you another reference, life expectancy has decreased in the US for the last 3 years without COVID-19 just because of the opiate crisis, right? So it doesn't have to be such a severe crisis to change the pattern of life expectancy. It can also be something else. Still, I would also suggest for the US that at the end, their life expectancy will go up as well.
Then another question for clarification. You showed the slide with the accumulated transfers from birth to death. And one of the participants is asking whether it is correct that the accumulated transfers from birth to death are higher than the accumulated revenues, or if that's a misinterpretation.
Well, that's a very good interpretation. I congratulate that participant to that analysis in such a short time. We are doing this obviously as well, but with Excel and much more time. No, this is actually true. So I wrote a paper once showing that every newborn on average is basically costing the German state more, given that structure, right? This is, I mean, statistical work. Given that structure, given a lot of averages and given a lot of assumptions, but actually, if you take that picture seriously, the participant is completely right that if you look at from 0 to 100, every birth is a kind of a loss, is a negative business value, so to speak, for the German state. I mean, you can't think like that, right? Children have their own value. Human life has their own value. And also we want to raise productivity, for example, through better education and so on and so on. So this is not a dynamic picture. This is a static picture, right? So it can change in the future. But yes, from that graph, we have a misbalance between revenues and transfers.
A second question is whether easing immigration requirements would solve the generational storm in OECD countries, or in case for the US, legalizing illegal immigrants, if that's a solution to what you were describing.
Yeah, that's also a very good question, and it's a very highly politicized one. The first glance answer is yes. I mean, more liberal migration laws would help in gaining more talent, and obviously, if you can attract talent, especially in that middle age, and migration is normally taking place between 20 and 50, right? So exactly in that age group where we want to have people or more people. So yes, liberalizing migration laws would help. However, as this is a global trend, and as many countries are experiencing that, from a global perspective, it's hard to figure out if this really is true, right? Because if I take away the Chinese engineer to Germany, then he or she is missing in China, yeah? So, and China has basically the same demographic problem through their one-child policy, for example. The question is, which countries are still young and which countries are old? There are still young countries like Egypt, for example, but then you have all the problems with, is this the same education level, languages, and so on and so on. But yes, I would suggest, and countries have done that, Canada has done that on the forefront, to have very liberalized but specific migration systems where you can cherry pick really the workers you need for your economy, and this helps in the generational storm as well, but not on a global scale, right? Just this is kind of a competition issue between countries.
If I may jump back with a question to elderly people again, do you see a new generation conflict arising as a result of COVID-19, especially when it comes to the health costs and higher risk profiles of elderly people?
I think that we will have a new discussion about health systems per se, not so much about elderly people per se, but rather about capacities. And again, this will be interesting for the generational storm, because if we increase the generosity of health systems because of COVID-19, and it's kind of a human thing to do, I think, right? I mean, currently I want to have as much beds as possible, yeah, also as a human being, but it's enormously costly given that demographic transition we are in 10 years, in 20 years time. However, we still then also need these beds. So the question is not do we have more beds, but how to finance them, right? How to finance that. And there will be probably a generational conflict, because I think we have to take more money of the elderly somehow, right? At least of the rich elderly. Yeah, I mean, you can't take more of poor elderly people, but we have to take more money of the rich elderly. Otherwise, we have this voting by feet, because then, for example, our students will just go to countries where this problem is not as severe, like, for example, New Zealand, Canada, or Switzerland. Yeah.
And one question in the other direction, how is social distancing affecting relationship building? Do you see people shifting to settle for more artificial relationships in the connected world? And in particular, what would be some of the common pitfalls that younger generations are susceptible to? How can they increase awareness and avoid them?
Well, it's a good question. It's not my area of expertise. I read a lot over the last weeks about especially social distancing and the effects of children. And there are some studies showing that this will have severe effects the longer it takes on not only the educational level, but rather also on this on the people skills of children. So for the German context, for example, some sociologists talking about Kaspar-Hauser syndrome. The Germans will remember that. This was a child which hasn't seen anybody for 20 years, back 300 years ago, right? Probably not as severe, but this will have a huge effect. I hope most studies I read said that we will probably return to our pre-COVID behavior quite fast. Yeah, so this is good news. People are kind of wired, right? And we won't be at least if COVID is only taking 2 or 3 years. I mean, this is a big if still, right? Because when the vaccination comes is a big question. But if we will really have 2 or 3 years of crisis, then people will jump to their older behavior quite fast again. What happens with children is a big question.
Follow-up question, well, on the management of the generational storm, or the management of the gap between the decline in fertility and the increase in life expectancy. Maybe you can comment on 2 further ideas that were mentioned by our participants. One is maybe longer parental leaves, with the hope that increases the pregnancies per capita. And the other one was postponement of retirement. Maybe you can comment on both ideas.
Okay, I take the second one, because this is one I'm traveling with through policy circles as well. I think this is in my opinion, this is a kind of no-brainer. If we live longer, and if we especially also live longer healthy, which we can be seen in statistic as well, then we have to increase retirement age. There's no doubt about that. And again, this is a phenomenon we see in some countries are far ahead of us. Sweden, Norway, for example, they index their pension age towards life expectancy. So automatically, if life expectancy goes up, the pension age goes up as well. And I think this is a very good idea, and we should do that in Germany, and the US will do that eventually as well. This is an idea which time has come and which we'll go for. The first idea, I'm not quite sure. There is mixed evidence in the literature about actually how to raise the fertility rate. Is it really parental leave, If you look at the US has a higher fertility rate without any parental leave, right? Switzerland has the same level with less parental leave than Germany. What we can see is there is a kind of clear link about the involvement of women in a society and the fertility rate, meaning that, for example, if you look at the female membership in parliaments and the fertility rate, there is a correlation, right? I can't say this is causal, right? Because, but obviously in countries like Sweden, like Norway, where women have more a say in society, there the fertility rate is also higher. There's also a nice study, quite new study from Germany, where they show that it doesn't matter from which party you are coming, if there are more females in local councils, in local parliaments, then there are also more kindergarten places and places for younger children. So obviously, women are helping themselves with these problems, and we have to let them, right? And the societies who do that, they have also a higher fertility rate.
There were more ideas mentioned by our participants, Christian, and I was wondering, you're an economist, so you look at the numbers, and we take a helicopter. Or you took a helicopter view. You took us on a helicopter view about these numbers and statistics, but there's also a very close link to ethics and the values we share in a society. So some of the other suggestions were, for example, how about not allowing pensioners to vote anymore? That would maybe also.
No, this is actually this is an idea by a Nobel Prize winning economist named Friedrich August von Hayek, who's a WHU honorary senator, right? And he had this idea in his head that he said, okay, everybody who's depending on the state, meaning not only pensioners, but also civil servants, for example, soldiers, they shouldn't vote, right? This was his idea. It wasn't his opinion, right? He just discussed this idea in a famous paper, and it's oftentimes misleading. I think this is a theoretical issue, at least, which won't solve the big problem. A much more interesting question, I think, is if you should get, for example, parents more votes, right? I mean, you can lower the votings of pensioners, or you can increase the votings of people with children, right? However, I think in general terms, we have to make, through enlightenment and education of the public, we have to convince that we are all sitting in the same boat. It's not pensioners versus young people. We are all sitting in the same boat. And if one side of the boat is becoming too heavy, then the whole boat goes down, right? It's not like that one side is breaking up and then the others are going on. It's that the whole boat is going down, or the whole ship. And therefore, we have to convince the pensioners and the elderly people that we have to balance that, not taking away, but perhaps taking away a little bit of the growth, for example, of pensions, or letting richer pensioners pay a little bit extra for their health benefits, and so on, to convince them that otherwise society breaks down.
I think that was such a beautiful final statement. We have come to the end of our time for today. So let's wrap up here. The final words go to you, Christian. Thank you very much to all participants for tuning in today. And thank you very much, Christian, for this very, very exciting talk.
Well, thank you for the invitation. Thank the participants for attending in these troubling times where everybody has extra work, extra stress, and taking the time to think long-term again. I think this is very valuable for me that people are still interested in these questions, and hopefully we stay in touch through the channels Rebecca mentioned, And I wish you that you can stay healthy. I wish your families the best, and take care of yourselves. Thank you very much.